Good morning, everyone, especially to you, ma'am. So, I am Sabia P. MacArthur. So, today I'm going to discuss the urinary elimination. So, urinary elimination is a process of removing waste product in our body in a form of urine. So, urinary elimination is also known as micturition and voiding. So, the introduction. The urinary system consists of organs that produce and excrete urine from the body. Urine contains waste, mostly excess water, salts, and nitrogen compounds. So, the primary organs are the kidneys. It also responsible for regulating blood volume and blood pressure. It regulates electrolytes. So we have the organs of the urinary system. The components of urinary system includes the kidneys, the uterus, and the urinary bladders, and urethra. So the first organ is, or the primary organ is the kidney. So kidney is a bean-shaped organ located at the back of the abdominal cavity. So they lie on either side of the spinal column. This area is also known as the flank area, is against the muscle of the back, and the external kidney has a notch at the concave border known as the hilum. The hilum is the entrance for renal artery, veins, nerves, and lymphatic vessels. So, merong internal structure ang kidney natin. So, we have the cortex, is the outer layer of the arteries, veins, and convoluted tubes and glomerular capsules. The second is the medulla, is the inner layer of the inner layer. So, merong doon, renal pyramid. So, ang function ni kidney is remove waste products from the blood and produce urine. So, ang kidney natin is siya yung nagfi-filter ng blood, and nagpo-produce din siya ng urine. So, kidney helps to control your blood pressure, and early detection of the kidney disease can be life-saving. So, the next one is, we have the key components of the kidney. So, we have the renal pelvis. Siya yung funnel-shaped cavity within the kidney that collects urine produced by the kidney. Urine natin produced by the kidney. Produced by the kidney, and ipapasa niya ito sa ureters, tube nung ihi. Dun, sa key component, meron tayong renal artery. So, these blood vessels carries oxygenated blood from the aorta in the kidney, supplying it with the necessary blood for flow, for filtration, and other function. So, we have the renal vein. The renal vein naman, siya yung nag-carry ng the oxygenated blood away from the kidney and the back of the inferior vena cava. So, the last one is the renal medulla. Siya yung inner part of the kidney containing structure like the renal pyramids where urine formation takes place. Doon sa renal pyramids, siya yung parang guhit doon sa kidney. Ipapakita ko sa taas. So, each kidney is made up of about 1 million filtering units. Tinatawag natin itong nephrons. So, each nephrons includes a filter called the glomerulus. So, doon sa renal pyramid, merong nephron doon. Then, doon sa nephron na yun, merong tinatawag na glomerulus, which is siya yung nag-help na mag-filter ng mga toxins. Pag na-filter na yung toxins, yung urine natin is bababa na sa uterus. So, pag bababa na siya sa uterus, papunta sa bladder natin. So, kapag yung bladder natin is napuno na, merong magsisignal sa nervous system natin na ang tinatawag siyang receptor signal. So, siya yung magsisignal sa atin na kapag napuno na yung pantog natin is kailangan natin siyang ilabas. So, uterus, bladders, and urethra. So, uterus, yun yung parang, yun yung tube, yun yung daanan nung, yun yung tube papunta sa bladder. Then, ang bladder naman, dun naiipon yung ihi natin. Then, urethra naman, yun yung daanan ng ihi natin. So, merong tinatawag na sphincter, which is, siya yung nagko-close and open doon sa passageway ng urine natin. Urine, the formation of urine has three processes, which is filtration, reabsorption, and tubule secretion. Urine consists of 95 water and 5% of solid. So, usually, in other book, 96% of water in our body and 4% in a solid substances. So, yung 5% na yan is yan yung urea, creatinine, ammonia, and uric acid. So, the need of urinate is usually felt at 300 to 350 ml of urine in the bladder. 1,000 to 1,500 ml is voided daily. So, yan yung dami ng kailangan nating ihi. So, araw-araw na yan siya. Yan yung kailangan nating malabas sa katawan natin.
Physical characteristics of urine. Physical characteristics of urine can provide clues about person overall health. And urine naman po is a liquid waste product produced by the kidneys that helps to remove waste and excess fluid from our body. We have different colors of urine. We have normal colors of urine, pale or transparent yellow, and light to dark yellow. Sa good naman po, we have indicates good hydration. Then other urine colors and potential causes, we have dark yellow, orange, red, or pink po. Can indicate dehydration. So, think of your body as a big complex machine. Just like a machine needs regular maintenance, your body needs to get rid of waste products to stay healthy. Urine is one of those waste products. Sa odor naman po is meron tayong makukuha ng iba't ibang uri ng amoy ng ihi. First is fresh, second is standing, and third is food and meats. Sa fresh naman po is we have kumbaga dito po malalaman natin na normal ang amoy ng ihi natin. Kumbaga mild lang po siya. Kumbaga slightly sweet po. Pag hindi naman po pag hindi mild yung ihi natin, it means hindi na po siya normal. Sa standing naman po, kumbaga example, nag-ihi po tayo sa sa CR, then iniwan po natin yung ihi natin, hindi po natin binuhusan. Then nagbalik po tayo. Kumbaga kinabukasan binalikan po natin. Kumbaga, di ba, ang amoy niya po is parang matapang na po, masakit na po sa ilong. And next po is food and meats. For example, sa food naman po is nagkape tayo. 'Di ba yung kape, yung iba yung amoy ng kape, kumbaga matapang. So ganun din po yung ihi natin, yung amoy ng ihi natin, kumbaga amoy din po natin. Kumbaga kung anong kinain natin, yun din po yung amoy niya. Then sa meats naman po, kumbaga example, amoxicillin. 'Di ba pag nag-inom po tayo ng amoxicillin, it's kumbaga ganun din po yung amoy niya. Then sa pH naman po, sa pH naman po, we have pH, meaning po ng pH is yung measure po ng acidic natin. Acidic, it means your urine is usually slightly acidic, like lemon juice. This means it has a lower pH level. Sa range naman po, but your diet can change this. Some foods make your urine more acidic. Others make it less acidic. Sa diet naman po, a diet high in protein or cranberries makes your urine more acidic and kind of like adding lemon to water. A vegetarian diet with lots of fruits and vegetable make it less acidic. Example, if you eat a lot of meat, your urine might be more acidic. If you eat a lot of fruits and vegetable, it might be less acidic. We have three specific gravity. First is concentration, second is normal, and third is fluids in health. Sa concentration po, this tells you how much stuff is dissolved in your urine. Imagine putting salt in water. The more you salt add, the more concentrated the water becomes. Sa normal naman po, it should be between 1.010 and 1.025. This is like a normal amount of salt in the water. Sa fluids in health naman po, if you dehydrated, your body tries to conserve water. So your urine will be more concentrated, higher specific gravity. If you drink a lot of water, it gets diluted, lower specific gravity po yun. And some medical condition can also change the specific gravity of your urine. An example, if you haven't had enough water, your urine will be darker or smaller, stronger, because it's more concentrated. If you drink lots of water, it will be lighter and less strong po.
Chemical characteristic of urine. Urine, a waste product filtered by kidneys, is primarily composed by water over 95% and contains various dissolved substances like urea, electrolytes, and waste product with a typical pH range of 5.5 to 7 point. Key components of urine. First, water. The primary components of making up over 95% of urine. Second, urea is a waste product of protein metabolism, a major constituent of urine. Third, electrolytes, ions like sodium, potassium, chloride, and bicarbonate, which play a crucial role in maintaining fluid balance and pH. And another, creatine is a waste product of muscle metabolism filtered by the kidneys and exerted in urine. And another, uric acid, a waste product of purine metabolism, also excreted in urine. Other organic compounds is trace amount of amino acid, glucose, and other metabolism may be present in normal urine. And the last is pigment. Pigment or chrome is a pigment derived from the breakdown of blood, gives urine its characteristic yellow color. So it means the urologic disease or condition include urinary tract infection, is kidney stone, bladder control problems, and prostate problems, among others. And urinary infection, disease found in urinary is urinary infects, kidney disease, and diabetes. And chemical examination of urine. The routine chemical examination of urine involves qualitative tests for protein, glucose, hemoglobin, ketone bodies, and bile pigments. These components are mostly present in urine from a healthy individual as well, but in tiny amounts, detectable by the routine test.
So, urination, when we say urination, It is also known as micturition or voiding. It is a process of emptying the urinary bladder. This process is crucial for our overall and well-being. So urination is the process begins with the stretch receptors. Yung stretch receptors na yun, it is a special nerve endings found in the bladder wall. So siya yung nagbibigay ng signal sa brain when indicating that it's time to urinate. So, adult and children have a different amount of urine. So, sa adult is 250 to 450 milliliters and sa children naman is 50 to 200 ml. So the importance of urination is a vital process that maintains our body's cleanliness and health. So regular urination helps prevent infections and other health problems. Kailangan natin mag-ihi ng regular para hindi magdulot ng infection at iba pang mga problema sa ating katawan. Para maiwasan natin yung infection sa loob ng katawan natin. So always remember that urination is an essential process that should not be taken for granted. We must maintain our body's cleanliness and health by urinating regularly and drinking plenty of water. Panatilihin natin ang ating katawan ng malinis at malusog sa pamamagitan ng pag-ihi ng regular at pag-inom ng sapat na tubig.
Factors affecting urination. So, meron po tayong growth and development, psychosocial factors, fluid and food intake, medication, muscle tone and activity, pathology conditions, surgical and diagnostic procedure. Sa factors affecting urination, ito yung mga kadahilanan na nakakaapekto sa pag-ihi ay mahalaga para sa ating kalusugan. So number 1, meron tayong growth and development. Ang paglaki at pag-unlad ng tao ay nakakaapekto sa pag-ihi. For example, mga bata ay may mataas na frequency compare sa mga matanda. Number 2 naman ay psychosocial factors o mga kadahilanan ng psychosocial. So sa mga kadahilanan ng psychosocial tulad ng stress, depression, anxiety ay maaaring nakakaapekto sa pag-ihi. Halimbawa, ang mga taong may stress, maaari sila magkaroon ng madalang na pag-ihi. Number 3 is meron tayong fluid and food intake, pagkain ng tubig at pagkain. So, ang pagkain ng tubig at pagkain ay nakakaapekto sa pag-ihi. For example, mga taong kumakain ng maraming pagkain na mayaman sa asin ay maaaring magkaroon ng madalang pag-ihi. So, number 4 naman is medication or mga gamot. Ang mga gamot na ito ay tulad ng diuretics ay maaaring nakakaapekto sa pag-ihi. Halimbawa, mga taong kumakain ng diuretics ay maaaring magkaroon ng mas madalang na pag-ihi. Number 5 naman is muscle tone and activity. So sa muscle tone at aktibidad ay nakakaapekto sa pag-ihi. For instance, mga taong may mataas na muscle tone ay maaari magkaroon ng mas mahusay na kontrol sa pag-ihi. So sa number 6, pathology condition o mga kondisyong pathologics. Ang mga kondisyong pathologics tulad ng diabetes ay maaaring makapag-apekto sa pag-ihi. Halimbawa, mga taong may diabetes ay maaaring magkaroon ng mas madalang na pag-ihi. So number 7 naman is surgical and diagnostic procedures o mga prosesong surgical at diagnostics. Ang mga prosesong surgical and diagnostic tulad ng cystoscopy ay maaaring makapag-apekto sa pag-ihi. For example, mga taong sumasailalim ng cystoscopy ay maaaring magkaroon ng mas madalang na pag-ihi o pagkatapos ng proseso.
So now, let's proceed to altered urine production. So the first is polyuria, also known as diuresis. So polyuria makes large amount of urine. In uncontrolled diabetes, polyuria occurs because of high blood sugar levels. The kidney removes some of this excess sugar from the body. The kidneys produce abnormally large amounts of urine. 2,500 ml a day for adults. And the causes of polyuria is excessive fluid intakes of alcohol and caffeine, diabetes mellitus, hormone imbalances, chronic chronic kidney disease, and other signs associated with diuresis, such as polydipsia, dehydration, and weight loss. So next one is oliguria, voiding scent amount of urine, less than 500 ml a day. So oliguria can caused by various factors including dehydration for not drinking enough fluids. Next is urinary tract obstructions. Any obstructions in the urinary tract, such as kidney stones, tumors, or scar tissue, can prevent urine from flowing properly and cause oliguria. The next is kidney problems. Conditions like acute kidney injury or chronic kidney disease can impair the kidney's ability to filter waste and produce urine. Next is medication. Some drugs like non-steroidal anti-inflammatory drugs, certain antibiotics, ACE inhibitors, or medications used to treat overactive bladder can sometimes cause oliguria as a side effect. And last is other medical conditions such as heart failure, sepsis, burns, and trauma. So, last is anuria. Anuria is the complete absence of urine production or excretion, typically defined as a urine output of less than 100 ml a day, and can be sign of serious underlying medical conditions. Anuria is the medical term for the condition where a person's kidney are not producing enough urine or are not able to excrete it. So, anuria can be caused by a variety of factors including kidney failure, urinary tract obstructions, dehydration, shock or severe blood loss, and medications or toxins. So, in addition to the lack of urine productions, um, other symptoms of anuria may include dizziness or lightheadedness, rapid heart rate, weaknesses, vomiting, shortness of breath, fluid retentions, and fatigue.
So, good afternoon, ma'am. I am Saima Usman and I'm going to report frequency and nocturia. So, first, what is frequency? Um, Frequency is this means you're needing to urinate much more often than usual. Even though you're going to the bathroom a lot, the actual amount of urine you pass each time is small, around like 50 to 100 millimeters. So, ang frequency is ito yung madalas na pag-ihi ng isang tao. And ang possible causes nito is marami kang nainom na tubig or like may bladder infection ka like cystitis. And also nakaka-affect din kapag may stress ka or anxiety. And also madalas tong nangyayari sa mga buntis. So next is nocturia. Nocturia is this when you wake up during the night to urinate more often than normal. It is important to distinguish this from simply drinking a lot of fluids before bed. Nocturia is when you're waking up frequently even if you haven't increased your fluid intake. So, ang nocturia is ito yung madalas na pag-ihi sa gabi. So, ano ba ang difference between nocturia and frequency? Ang frequency is ito yung madalas na pag-ihi natin sa umaga, and yung nocturia naman is ito yung madalas na pag-ihi natin sa gabi.
So, the topic we're going to discuss is the urinary eliminations. So, before that, what is urgency? Urgency refers to the feeling that a person must urinate immediately or urgently. So, it the sudden intense need to urinate that feels like it cannot be delayed. The person experiences a strong uncontrollable urge of empty their bladder, often leading to the fear or not making it to the bathroom in time. Feeling that the person must avoid. So the sentence feeling the person must avoid means that the person has a strong urgent sensation or need to urinate or void. The term void is a medical term that means to pass urine. So in simplifier term, this sentence is ito ay tumutukoy sa pakiramdam na ang isang tao ay kailangang umihi ng agara at hindi na ito kayang ipagpaliban. So, usually accompanies psychological stress and irritation of the urethra. So, the sentence usually accompanies psychological stress and irritation of the urethra means that the certain conditions such as the feeling of urgency or discomfort while urinating often happen together with psychological stress, emotional and mental pressure, and irritation of the urethra. So, the tube that carries urine from the bladder out of the body. So, what is psychological stress? So, ang psychological stress ay tumutukoy sa pakiramdam ng pagkabahala, presyon o mental na pagkapagod. So, maaari itong makakaapekto sa ating katawan sa iba't ibang paraan kabilang na ang sistema ng pag-ihi. So, irritation of the urethra. Ito ay nangangahulugang ang urethra o ang tubo na kung saan dumadaan ang ihi. Ito ay namamaga or inis na maaaring magdulot ng hindi komportable. So, nasusunog ang sensasyon o hirap sa pag-ihi. In summary, the sentence suggests that when someone is stressed or experiencing irritation in their urethra due to the infection or other causes, they may also experience issues like frequent or urgent urination. Ang children's. So, karaniwan silang may kaunting control sa kalamnan or muscle na ito dahil nagsisimula pa lamang silang matutong kontrolin ng maayos ang kanilang pag-ihi. So the sentence suggests the young children, especially those who have not yet developed proper control over the muscles around their urethra, may experience more accident or issues with urinations. So this is common developmental stage as they grow and gain better control over their function. So let's going to discuss the dysuria. Dysuria refers to the painful or uncomfortable urinations. It is a symptoms characterized by a burning or stinging sensation during urinations. So kadalasan itong nauugnay sa mga kondisyon tulad ng urinary tract infection or also known as the UTI, infection sa pantog o iritasyon sa urinary tract. So, voiding that is either painful or difficult. The sentence voiding that either painful or difficult refers to the process of urinations, voiding that causes either pain or difficult for the person. So, voiding, this is a medical term for urinations. So, ito ay ang akto ng pagpapalabas ng ihi mula sa ating pantog. So, painful, this means that urination is accompanied by discomfort or a burning sensation na karaniwang dulot o impeksyon ng pamamaga sa ating urinary tract. So, difficult refers to the challenge or starting or completing urinations. So, maaring dulot ito ng mga bara or mahihinang kalamnan or muscle sa ating pantog o iba pang mga isyong medikal. In summary, this sentence describes a situation where urination is either causing pain or is challenging to do, often linked to conditions like urinary tract infection, bladder issues, or other urinary system problem. Result from stricture of the urethra, urinary infection, injury to the bladder and or the urethra. So the sentence may result from stricture or the urethra, urinary infection, injury to the bladder and or the urethra. Means that the certain urinary problems such as difficulty or pain during urination can be caused by different conditions affecting the urinary system. Urinary hesitancy is a common issue that occurs along with the burning sensation, which could be due to the condition like urinary tract infections, also known as UTI, prostate problem in men, or other urinary system issues. In summary, the sentence is describing how difficult or delay in starting urination.
Enuresis. So first, what is enuresis? Enuresis is commonly known as a bedwetting. It is a condition where individual involuntarily release urine, often during sleep. It occurs at night. Often during sleep, it occurs at night. Nocturnal enuresis, or during the day, diurnal enuresis. This condition is more commonly in children but can also affect teenager and adults. So we have effect of enuresis. We have development delays. Ang development is delays is lower physical development can affect bladder control, and we have small bladder capacity. The bladder may not hold enough urine. Genetic or pwede rin sa genetic, kumbaga namana mo sa mga lola't lola mo. A family history of enuresis can increase the likelihood. Nakasali din dito ang stress or anxiety. Emotional factor can contribute to the condition. We have also medical condition issues like urinary tract infection, diabetes, or sleep apnea may play a role. One is urinary incontinence. It's a condition where the person accidentally leaks the urine. Hindi ito disease itself, but sign that something might not be working as a child in the urinary system. There's a different types of urinary incontinence, and it has its own cause characteristic po. The number one is functional incontinence. This type is not caused by any problem with the bladder itself. Instead, it happens when someone can reach the bathroom in the time due to physical mental challenges. For example, if someone has arthritis and struggle to undo buttons quickly. So, yun nga po na yung hindi mo mapigilan yung ihi mo. So, mahirapan ka talaga yung nabibilisan ka sa pag-ihi. So, karamihan sa atin po ay nakaranas din po sa ganung pangyayari. Or they are confused and don't realize they need to go. They might be experience functional incontinence. Number 2 is reflex incontinence. In this case naman po, the bladder releases the urine involuntarily when it becomes too full. This often happens at predictable times like when the bladder reaches a specific limit. So, yung nangyayari po sa atin po yung bladder natin na may limit lang po yung nagkikarry niya ng urine. It's common in people with the spinal cord injury or nervous system disorder because their brain can't afford control the bladder as it is normally walled. So, number 3 naman po, stress incontinence. This is when a small amount of the urine leaks out due to the pressure on the bladder. It might happen when you pag mag-ubo ka and sneeze or tumawa ka, lift something heavy, or even exercise. It more common in women, especially after childbirth or menopause, because these events can weaken the muscles that support the bladder. So number 4 is total incontinence. Total incontinence, this type of involves continuous and unpredictable loss of urine. It could be caused by serious medical condition like an abnormal connection between the bladder and another body part. Condition known as a fistula, severe damage on the bladder muscle. Number 5 naman, urge incontinence, often called an overactive bladder. This happens when a person feels strong, sudden need to urinate the legs urine before making it to the toilet. It can be triggered by things like drinking water, hearing running water, or even just feeling cold. It's due to the bladder muscle contracting at the wrong time.
I will discuss the urinary retention with overflow. So what is urinary retention with overflow? Urinary retention with overflow refers to a condition where the bladder is unable to empty fully, leading to the retention of urine. As a result, the bladder becomes overly full, causing urine to leak or overflow involuntarily. So this overflow occurs because the bladder cannot hold any more urine and pressure builds up, leading to uncontrolled leakage often in small amounts. So this condition can be caused by a variety of factors, including bladder outlet obstruction such as an enlarged prostate in men, nerve problems, or weak bladder muscles. Symptoms may include frequent urination, difficulty starting urination, a feeling of incomplete bladder, and a feeling of incomplete bladder emptying, and the unexpected leaking of urine. So the treatment depends on the underlying cause and may include medications, catheterization, or surgery. So the second is neurogenic bladder. So the neurogenic bladder is a condition where the nerves that control the bladder are damaged, leading to abnormal bladder function. This can result from various neurological disorders or injuries that affect the nervous system, such as spinal cord injuries, multiple sclerosis, or stroke, Parkinson's disease, or diabetic neuropathy. In neurogenic bladder, the normal coordination between the bladder muscles and the brain is disrupted, which can lead to two main types of bladder dysfunction. So, overactive bladder, hyperreflexic bladder, the bladder contracts too frequently or uncontrollably, causing urgency, frequency, and incontinence. Second is underactive bladder. The bladder fails to contract adequately, making it difficult to empty fully. So this can lead to urinary retention and overflow incontinence. So ang symptoms ng neurogenic bladder is incontinence, leaking urine, difficulty starting urination, urinary retention, inability to fully empty the bladder, frequent urinary tract infections, dribbling or weak stream of urine. So, treatment typically focuses on managing the underlying cause, preventing complications like UTIs or kidney damage, and restoring normal bladder function through methods such as intermittent catheterization, medications,
bladder training, or in some cases surgery.
So, urinary retention or ang pagpigil ng ihi. So, if ever na ma-feel mo is makaihi ka, is as soon as possible is dapat mag-ihi ka na. Kasi nga isa ito sa dapat ilabas kasi dumi na nararamdaman din naman natin kapag makaihi na tayo kasi parang puno na yung bladder natin. Parang yung sa puson god na matigas siya na dapat na ilabas mo na yung ihi mo. And then, ang pagpigil ng ihi, isa ito sa mga cause na pagsakit ng UTI or pagtubo ng UTI. And then, ang oligonuria or anuria is ang oligoria is maaring sanhi is iba't ibang sakit or condition like dehydration. So, pwede ka maging dehydrate kasi nga if yung dumi na dapat ilabas mo na is mababalik pa na magiging infection na pagkasakit ng puson mo. And then ang second is anuria naman is pwede ito maging maluhob sakit like sakit sa bato, yung pagpigil ng ihi mo kasi if you feel na puno na yung bladder mo is dapat talaga ilabas mo yan siya kasi nga dumi na galing sa katawan na dapat nating ilabas.